welcome to our video on brachial plexus. Today I'm going to try to make the brachial plexus very simplified and easy to memorize. But before I go on and discuss the brachial plexus, I just wanted to emphasize on an important anatomical point, which is the relationship between cervical spinal nerves and their corresponding vertebral levels. So for cervical spinal nerves, the spinal nerve exits the cervical spine above the level of the corresponding vertebra, or the corresponding cervical vertebra. So for example, C5 emerges from the vertebral column on a level between C4 and C5. C6 emerges between C5 and C6, so it emerges above C6. C7 is the same, emerges between C6 and C7, so it emerges above C7. And then when it comes to C8, because we don't have a C8 vertebra, C8 emerges between C7 and T1. So again, there is no C8 vertebra. So C8 spinal nerve emerges between C7 and T1. And then starting from T1 all the way down, the spinal nerve emerges below the level of their corresponding vertebra. So T1 spinal nerve emerges below the level of T1 vertebra. T2 spinal nerve emerges below the level of T2 vertebra. Alright, so now let's go into the details of the brachial plexus. I always memorize the brachial plexus with this mnemonic, which is, remember to drink cold beverages. The R refers to the roots, the T refers to the trunks, the D refers to the divisions, C refers to the cords, and the B refers to the branches. So the first part of the brachial plexus is the roots, right? So the roots are the spinal nerves. We have roots starting from C5 all the way to T1. So we have C5 root, we have C6 root, we have C7 root, we have C8 root, and then we have T1 root. After the roots, we have the trunks. So let's draw the trunks. We have the superior trunk, which is made of the union of C5 and C6. So C5 and C6 unite and form the superior trunk or the upper trunk. C7 stays as it is and forms the middle trunk. C8 and T1 will unite together and form the inferior or the lower trunk. Each of these trunks will divide into an anterior division and posterior division. So the third part of the brachial plexus is the divisions. So let's draw the divisions. First, I'm going to draw the anterior divisions of each trunk. So the superior trunk has an anterior division. The middle trunk has an anterior division which joins the anterior division of the superior trunk. The inferior trunk has an anterior division as well. Alright, so now let's draw the posterior divisions of each trunk. The posterior division of the superior trunk will go this way and joins the posterior division of the middle trunk. And the posterior division of the inferior trunk will do the same thing. It will join the posterior divisions of the superior and middle trunk. Alright? So the superior trunk and middle trunk anterior divisions are together. The inferior trunk anterior division is alone. And all the posterior divisions of the three trunks join each other. Alright? So now we are done with the roots, trunks, and divisions. Alright, now for the chords, we have the lateral cord, we have the medial cord, and we have the posterior cord. These names are in relation to the axillary artery. So starting from this level here, the axillary artery divides the brachial plexus into lateral cord, which runs lateral to the axillary artery, medial cord, which runs medial to the axillary artery, and posterior cord, which runs posterior to the axillary artery. This is just why they were named lateral, medial, and posterior. And finally, we have the branches. let me just draw the branches here. So the lateral cord will continue and give rise to this branch or nerve, which is called musculocutaneous nerve. And then the posterior cord will continue and give off two nerves or two branches. One is big and thick. It's actually the biggest on the brachial plexus, which is the radial nerve, and another smaller branch called the axillary nerve. And then the medial cord will continue and give rise to the ulnar nerve. And then the lateral cord and the medial cord will contribute together and form this nerve right here, which is called the median nerve. Some people like to memorize it with the mnemonic MARMO. M stands for musculocutaneous, A stands for axillary, R stands for radial, the M stands for the median nerve, and finally the U stands for the ulnar nerve. Remember, these are the terminal branches of the brachial plexus. We do have more branches that emerge from the roots, the trunks, and the cords. So let's just map them out quickly, and then I'm going to go into details on how to easily memorize them. Starting here from C5, we have a nerve that's called Dorsal Scapular Nerve. And then from the roots as well of C5, C6, and C7, there is a long nerve here called long thoracic nerve. From the superior trunk, we have two nerves. One is called nerve to subclavius muscle, and another one called suprascapular nerve. And then from the lateral cord, we have only one nerve, that's the lateral pectoral nerve. From the posterior cord, we have three nerves: upper, middle, and lower subscapular nerves. And then from the medial cord, we have three nerves. One is called the medial pectoral nerve. The other one is called the medial cutaneous nerve of the arm. And finally, the last one is called medial cutaneous nerve of the forearm. Alright, so here are some hints that would help to memorize all these nerves and help to stick it to mind. First, the roots of the brachial plexus gives off only two nerves. So only two nerves comes off the roots. The first starts with D and the second starts with L. The D and L in alphabets are before S. So from the roots we have two nerves. One is called dorsal scapular, and the D is before the L as well. So the D will come off only C5 root. The L will have contributions from C5, C6, and C7. From the trunks, we only also have two nerves. and the 2 starts with the S. And as I said, the S comes after the D and L. So we have nerve to subclavius, and we have suprascapular nerve. And these 2 nerves arising from the superior trunk, which is made of C5 and C6. So both of them will be C5 and C6. C5 and C6. Now, the divisions do not give off any branches. So again, no branches comes off the divisions. So now we already knew the nerve that comes off the roots and the nerves that comes off the trunks. 2 nerves comes from the roots, 2 nerves comes from the trunks. The 2 nerves that comes from the roots starts with the letters D and L, which are early in the alphabets than the letter S. We have the dorsal scapular, that's the earliest in the alphabets, so it comes from only C5. And we have the L, which comes later in the alphabet, so it comes off C5, C6, and C7. And then only the superior trunk will give off 2 nerves. That starts with S. So nerve to subclavius and suprascapular. And you can also easily stick that with the letter S of the superior. So superior gives off to 2 nerves that starts with S. So nerve to subclavius and suprascapular. And since both are arising from the superior trunk, which is made of C5 and C6 only, so they are derived from C5, C6, C5, C6. Alright, so for the chords, we have 3 chords, as we know. Each chord will give off some branches. The lateral and medial chords will give branches with their corresponding names. So the lateral chord will give off only 1 branch that starts with lateral, which is lateral pectoral nerve. The medial chord gives off 3 branches that all starts with medial. So medial pectoral, which is the homologous to the lateral pectoral on the other side. And then medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm. The lateral pectoral nerve emerges from the lateral cord. And the lateral cord is made of the anterior divisions of the superior and middle trunks. So that makes us think that lateral pectoral nerve is made of C5, C6, and C7, which is true. Because C5 and 6 are the superior trunk, C7 are the middle trunk, and then the anterior divisions of both of these trunks will make the lateral cord. So that's why lateral pectoral nerve is C5, C6, and C7. This is exactly the same as for the musculocutaneous nerve as well. So the musculocutaneous nerve as well is C5, C6, and C7. The medial cord and its 3 branches are all derived from just the anterior division of the inferior trunk. So this makes us imagine that all of them are derived from C8 and T1, which is very true. Medial pectoral nerve is C8T1. Medial cutaneous nerve of the arm is C8T1. Medial cutaneous nerve of the forearm is C8T1. And also the ulnar nerve, which looks like the continuation of the medial cord, is also C8T1. Pretty easy, huh? Now the posterior cord gives off 3 branches, the upper, middle, and lower subscapular nerves. The upper and lower subscapular nerves supply the same muscle, which is subscapularis. It's part of the rotator cuff muscles. These 2 nerves are derived from C5 and C6. The middle subscapular nerve has a more fancy name, which is thoracodorsal nerve. The thoracodorsal nerve supplies the biggest muscle of the back, which is latissimus dorsi. Latissimus in Latin means the broadest, or the broadest muscle of the back. An easy way to memorize these nerves is all the rotator cuff muscles are supplied by nerves that are derived from C5 and C6. We're going to discuss the rotator cuff muscles in later videos, but for now, the rotator cuff muscles are 4 muscles. They are the subscapularis muscle, the supra and infraspinatus muscles, and the teres minor muscle. These are muscles that helps to stabilize the shoulder joint and keep the head of the humerus in place in the glenoid fossa. All these four muscles are supplied by nerves that are all derived from C5, C6. These are the suprascapular nerve. So the suprascapular nerve is C5 and C6. The upper and lower subscapular nerves are C5 and C6, and they supply the subscapularis. And the axillary nerve, which supplies the teres minor, is also C5 and C6. The thoracodorsal nerve, you just have to memorize it. It's derived from C6, C7, and C8. Now we are left with two nerves. The radial nerve, which is the biggest branch of the brachial plexus, and so it's derived from all the nerve roots of the brachial plexus. So it's derived from C5 all the way to T1. So the entire brachial plexus. The median nerve is the second biggest, so it just skips C5. So it starts from C6 all the way to T1. So finally, here is just a summary of all the branches of the brachial plexus. So first, the branches that comes off the roots. We only have two nerves. The dorsal scapular nerve that's derived from C5 root, long thoracic nerve that's derived from C5, C6, and C7. The dorsal scapular nerve supplies the rhomboid major, rhomboid minor, levator scapulae. The long thoracic nerve supplies the serratus anterior muscle. For the trunks, it's only the superior trunk that gives off branches, and these are nerve subclavius and suprascapular, so the S goes with the S. Both of them are derived from C5 and C6 nerve roots. The subclavius, or nerve to subclavius, supplies the subclavius muscle. Suprascapular nerve supplies the supraspinatus and infraspinatus muscles, and these are part of the rotator cuff. For the divisions, there is no branches that comes off the divisions. As for the cords, we have the lateral, medial, and posterior cord. The lateral cord gives off only one branch, that's the lateral pectoral nerve, which is derived from C5, 6, and 7, and it supplies the pectoralis major. The medial cord gives off medial pectoral nerve, which is derived from C8 and T1, and this supplies pectoralis minor as well as the pectoralis major. So the pectoralis major takes contributions from the medial pectoral nerve and the lateral pectoral nerve. And it's easy to memorize because if you add these two nerves together, you're going to have the entire brachial plexus from C5 all the way to T1. So the lateral pectoral takes off C5, 6, and 7, and medial pectoral takes C8 and T1. And as I said, both nerves supplies pectoralis major. Then we have the medial cutaneous nerve of the arm. This supplies the skin of the arm, so this is just a sensory nerve, and it's derived from C8 and T1. The medial cutaneous nerve of the forearm, it's also a sensory nerve, and it's also derived from roots C8 and T1. As for the posterior cord, we have three nerves as well. We have the upper subscapular and the lower subscapular. Both of these nerves supplies the subscapularis muscle, and they are derived from C5 and C6. And as I said before, the subscapularis is part of the rotator cuff muscles. The lower subscapular nerve also supplies another muscle, which is the teres major. The middle subscapular nerve has another fancy name, which is thoracodorsal, and the thoracodorsal is derived from C6, 7, and 8, and it supplies a big muscle in the back called latissimus dorsi. The terminal branches, I'm just going to go through their motor contributions. I'm not going to discuss their sensory contributions. We can discuss that in a separate video. First is the musculocutaneous nerve. It's derived from C5, 6, and 7, and it supplies the anterior compartment of the arm. That includes the biceps brachii, brachialis, and coracobrachialis. The axillary nerve is derived from C5 and C6. It supplies the deltoid, the big muscle of the shoulder, and the teres minor, which is part of the rotator cuff muscles. The radial nerve, which is the biggest nerve of the brachial plexus, it's derived from all the nerve roots of the brachial plexus, starting from C5, C6, C7, C8, and T1. It supplies the posterior compartment muscles of the arm and forearm. Remember, there is no posterior compartment muscles of the hand, so the radial nerve does not have any motor contributions to the hand. The median nerve is the second biggest nerve of the brachial plexus, so it starts from C6 all the way to T1, and it supplies the anterior forearm muscles except the medial half of the flexor digitorum profundus and flexor carpi ulnaris muscles, which are supplied by the ulnar nerve. It also supplies the first two lumbricals in the hand and thinner muscles of the hand as well. And finally, the ulnar nerve, which is derived from C8 and T1, it supplies the medial half of the flexor digitorum profundus and the flexor carpi ulnaris muscle in the forearm. And finally, all intrinsic muscles of the hand are supplied by the ulnar nerve, except the thinner muscles and the first two lumbricals, which, like we said, is supplied by the median nerve. And that concludes the video on the brachial plexus. Thank you for listening. Please, if you like the video, subscribe to our channel, like, share, and comment. Thank you, and see you next time.